good afternoon, greetings for the day. I am Anuja Purohit from All About Skin Wellbeing team. I am sure you all must be keeping good health. We all know that taking good care of our skin is really important for more than just your appearance. It adds into your confidence and everything. But there are some diseases that may affect our skin, the texture of it, appearance of our skin. One of them is fungal infection. Fungal infection or mycosis, these are the diseases which are caused by specific types of fungus. It can be yeast or mold or any other thing. Fungal infections may vary from mild to severe forms. Mild fungal infections can look like a rash and it can be very itchy and annoying. And severe, we can understand how severe fungal infections may look like. To treat such kind of conditions, antifungal medications are used. And antifungal medicines can kill a fungus or they may stop it from multiplying or growing. And there are several classes of antifungal medications and different types of medicines for that. So let's connect today with our skin expert, Dr. Reshma N P, live from Bengaluru to enlighten us on the topic of antifungals. Dr. Reshma N P is an MBBS diploma in Dermatology, Venereology and Leprosy. She has a rich experience of almost 4 years. Currently, she is in Bangalore. She is a founder of Kalon Skin Care Clinic at Bengaluru. She has in-depth knowledge of related areas and have placed immense trust in her patients over the years. So let's welcome Dr. Reshma to our stream today. Welcome, Doctor.
Thank you. Thank you so much.
It's really good to have you here. As you know that today we are going to talk about fungal infections and role of antifungals in treating such conditions. So
Yes.
let's start with a scratch. What is a fungal infection?
When we say fungal infection, it is just like an infection which is either caused by a fungus. The fungus will be either a superficial fungal infection where it is going to affect only the upper portion of the skin, or it can be a deep fungal infection where the fungus has the capacity to invade deeper than the skin, even including the blood vessels, and can spread throughout the body. But the most common fungal infection which we encounter from day-to-day life is what is known as superficial fungal infection. In common terms, we call it as ringworm, or in medical terms, we call it as tinea infection.
Right. How fungal infections are different than bacterial infections, and how they are different in treatment options also?
As such, bacterial infections are usually short-lived and it is very easy to treat them. It can be treated within 5 to 7 days. But the problem with fungal infections is that the treatment requires a longer period of time, and there are also local factors which affect our treatment. The drugs which we give for a fungal infection like antifungals do not reach the skin to a sufficient quantity, or the sufficient levels are not reached in the skin. Thereby, the treatment has to be continued for a longer period in case of a fungal infection. Whereas if it is a bacterial infection, it is easier to treat and the infection will subside within 5 to 7 days. Whereas in fungus, the treatment has to be continued for a longer period of time based on the severity as well as since how many days the patient is suffering from such particular fungal infection.
Right. What are the main reasons for developing fungal infections? And do we see such infections in day-to-day life?
Yes, the main reason what we encounter in a day-to-day life is moisture. When the skin contains too much of moisture than when it is required, like that happens when we are wearing clothes which are wet, which are not dried up properly, or in those people who sweat a lot and even their sweat retention in between the skin folds. These two are the major factors which actually trigger a fungal infection. And apart from that, the third important thing is immune deficiency. When a person is immune deficient, either because they're taking some drugs to suppress their immunity, or when the person is having a chronic disease like diabetes or cancerous patients, they too develop fungal infections more commonly.
Right. And are there any effects of weather conditions or diet in developing fungal infection?
Weather conditions, definitely yes. If the patient is staying in a weather where it is too foggy, always rainy and cold climate, it is most possible that the clothes which they put up into the sun does not dry up properly, and they have too much of moisture present in the skin, so that they usually wear those half dried wet clothes onto their body, and that moisture actually triggers the growth of the fungus on the skin. Secondly, it is also true in people who are wearing who are staying in very humid climates, where the temperature is so humid and their sweating is so continuously happening that there is sweat retention that might occur in the skin fold, especially in the groin region, in the underarms region, that can again stimulate the production or the multiplication of fungus, resulting in an infection.
So, which are the common body parts that may catch fungal infection quickly?
The most common part which we encounter is the groin region, meaning the region which is in between the thighs and in the buttock region. Followed by that, in women, we see it beneath the breast, and then the underarms. These are the most common regions, but it can occur in any part of the body. And people who are used to repeatedly washing their hands or repeatedly washing their feet, we encounter fungal infections in between the toes and between the fingers, and even in the soles and palms of the body.
Right. So overwashing our hands or feet can also cause fungal infection.
Yes, correct.
All right. And diet, is there a role of diet in fungal infections?
No, not directly. There is no direct role of diet in fungal infections. Most people have this myth that eating of particular vegetables or even consuming non-vegetarian diet can actually increase the itching. And many patients who come to me, they're already on diet, saying that someone told me that I have to stop eating chicken, fish, and mutton. But there is no direct role of diet to the fungal infection. What we say during the fungal infection treatment is that because our tablets are of higher dosages, we just ask them to stop the consumption of alcohol and stop smoking to prevent the deteriorating effect on the liver as well as the stomach. Apart from that, there is no role of diet in treatment or in controlling a fungal infection.
Right. In the beginning, I said that mild fungal infection may be from a little rash, or it can be itchy and annoying. So, how do you grade fungal infection, mild to severe?
Like when it comes to the superficial fungal infection, which we will be talking mostly about today, it usually starts as a small dot and then it progresses to become a ring-like structure. So it just expands and expands, where there will be sensory clearing of the infection, but then it keeps on expanding. So when we say mild fungal infection, it is those small papules or what we call the small dot reddish-like stuff, which is the initial stage of the fungus. And once when it expands, it becomes bigger and bigger, and the itching becomes more. And then at the ring, outside of the ring, you can again see small reddish dots, which indicates that the newer lesions are appearing. So when the newer lesions are appearing, we classify it as an active fungal infection. If there is no newer lesions, it is a dormant fungal infection. But the fungus is still there, but it has stopped multiplying. And when it crosses certain body surface area, like if it is present only in one region, say for example groin, we call it as mild. But once it becomes more extensive and it spreads to the other portion of the body, like it is involving the entire body, sometimes even spreads to the face also, then we classify it as extensive or severe fungal infection.
Right. This was about superficial fungal infection, but our inner organs like kidney or any other organs, can they catch fungal infection?
Yes, they definitely can catch fungal infection, but that will happen only in patients who are immunodeficient. Like if they are having diabetes, but it is uncontrolled and their sugar levels are very high, or if they are on any immunosuppressive drugs for either cancers or organ transplantation, and any other long chronic illnesses like cancers, or especially nowadays we have HIV/AIDS pandemic going on. So when the patient is HIV positive, then only we see those fungus which can infect the inner organs. But in normal people who are not having HIV/AIDS or whose their immune immunity is very good, fungus will not cross beyond the skin. It will usually stay in the skin.
If the fungal infection is superficial, can it be life-threatening?
No. If the fungal infection is just limited to the skin and the mucosa, it is not life-threatening.
Right. Now here comes the role of antifungal medications, what we are going to discuss today. So what are antifungal drugs and how do they act to suppress fungal infection?
Antifungal, as the name suggests, they act against the fungus which is present in the body. We usually divide into two categories. One is fungicidal, the other one is fungistatic. What fungicidal drugs do is they kill the fungus altogether, whereas fungistatic drugs just suppress the growth of the fungus. Once the growth of the fungus is suppressed by the fungistatic drugs, the immunity of the body will take care of that fungus, and it is going to destroy the fungus. So we have two categories as of now.
So how do they act? I mean, you described about two categories. So of course,
Yeah.
their for treatment will be different, and according to body parts or according to the site and severity, how do they act?
The thing is, we usually prescribe a combination of both fungicidal as well as fungistatic drug to any particular patient. Usually, those drugs actually destroy the cell wall of the fungus, thereby the fungus cannot multiply. There are certain drugs which actually directly act on the DNA of the fungus, thus preventing multiplication. There are certain fungus which destroy the cell membrane and thereby destroying the fungus altogether. So whenever we treat fungus which is in mild severity, we go for just fungistatic drugs. Whereas if the fungus is very extensive, we go for a combination of fungicidal as well as fungistatic drugs.
So fungicidal and fungistatic drugs, how do patients take those drugs? Are there oral medicines or ointment in the form of ointment, cream? How?
Again, it depends on the severity. As we assess the patient, we decide whether to give them just ointments or creams, or whether we have to combine it with a tablet as well as the ointment. So usually it will be better if we give the patient with an oral drug, oral antifungal medication along with topical. The combination will work better when combined together instead of giving just oral or just the ointment base. So usually the combination is better.
Many of the times people have this myth that taking any such kind of medication will cause side effects. So are there any potential side effects of antifungal drugs?
Definitely. Just like any other medications we have in the market, even antifungal medications also have side effects. But if they're taken in the dosage which is prescribed by a qualified dermatologist, and if the proper dosage is continued or followed, and how many months it has to be taken, if that is followed as advised by the dermatologist, then the side effects will be to the minimum. But if the patient is going for a self-medication without consulting a dermatologist, or if they continue taking this drug for a longer period of time without again consulting a dermatologist, then the side effects will be detrimental for them.
Right. And how long does a person need to take antifungal drugs?
Presently, we are experiencing too much of fungal resistance. When the antifungal drug actually came into the market, we used to prescribe it for some 15 days to 1 month. But now, because of too much of self-medication and purchase of these antifungals from over the counter from the pharmacies, and we see quacks and other people who have no knowledge of antifungals just prescribing them left and right for any skin condition, irrespective. They cannot diagnose what condition it is, but they just prescribe it left and right for all conditions. We have come to a stage where now we have to continue the treatment for 2 to 3 months, and sometimes even for 6 months to completely cure the fungal infection. So at present, we have come to the scenario where the resistance is too high, and I treat my patients for a minimum of 2 months, and sometimes if the severity is too much, it will continue up till 4 to 6 months.
Right. So fungal resistance, it is because of overuse of medications or wrong use of antifungal medications or self-treatment of patients. So what actually does it mean? Fungal resistance, what you said. Can you please elaborate for us?
Say, for example, it is just like a human being. If we move from one place to another place and there is some weather condition change, in the beginning, we are susceptible to those weather conditions. Like if we move from a hot place to a cold place, immediately we catch some cold, we start having a runny nose. But when you continue staying in that environment for a longer period of time, you are going to adapt to that environment, and then you're going to get adjusted to that particular place. Then in future, you will never have such problems like runny nose, cold cold or fever. The fungus does the same thing also. When the patient continues taking an antifungal medication for a longer period of time repeatedly, but the dose is such that it is not killing the fungus, but it is making the fungus getting used to that particular medication. The fungus will get used to that medication and it will learn to sustain and multiply and live in that environment where the antifungal medication is there. That is what we know as fungal resistance, where the fungus will learn to evade the action of the antifungal medication.
You said that you treat your patients with antifungal drugs, and you say that at least 2 months of period is required totally curing of that disease. Are there any potential side effects that you tell your patients that, okay, these are the side effects that you may encounter, and you consult them to take it normally? Are there such kind of side effects?
When it comes to oral medications, that is tablets which have to be swallowed, the only side effects which we encounter within 2 months in most of the patients is gastritis, that they feel that there's bloating sensation and burning sensation in the stomach. Apart from that, up to 2 to 3 months of age, not much of side effects are encountered. When it comes to the ointments, most patients complain that once they apply the ointment on the fungal infection, they experience burning sensation, and sometimes itching also increases in the initial stages. Apart from that, up till 2 months, in my 4 years of experience, and even before that, when I was learning the subject, we have not experienced any life-threatening or any severe side effects from the antifungal drug if the dosage is taken properly and all the instructions are followed correctly.
Right. Are there any contraindications of giving antifungal drugs? I mean, who should not take antifungal drugs?
The first thing I would like to tell is for pregnant women, not all antifungal medications are approved in pregnancy. Certain drugs can cause problem to the baby which is growing in the going in the uterus. So if you are pregnant and if you are suffering from a fungal infection, then they have to visit a qualified dermatologist and get themselves those drugs which are suitable for during pregnancy, to be taken during pregnancy. Usually during pregnancy, we avoid the oral medications and try to treat the infections with topical. But if the infection is very extensive, even go for oral medications which are safer in pregnancy. Secondly, coming to those people who are having heart problems, the antifungal medications, if taken in a high dosage and for longer period of time, can actually worsen the existing heart problems. So we tell patients who are having heart problems to not take antifungal medications. The dosage is usually reduced. The same thing is true for people who are suffering from liver disease as well as kidney disease. All the drugs which we take are actually eliminated from the body via the liver or via the kidney. So any drug for that matter, if the patient is suffering from a liver or a kidney disease, the dosage has to be adjusted according to that particular patient. So these are the 4 categories of patients who have to be very careful when they are taking an antifungal medication.
Right. We always say that prevention is better than cure. So to prevent fungal infections, what steps one should take?
The first thing is the fungal infection spreads from person to person. It is usually due to direct contact one. So if you're having fungal infections in your hand, please avoid shaking of your hand. And if you're having it in your feet, avoid sharing of your slippers and shoes with some other person, and avoid sharing of socks also. If the fungal infection is in your body, keep your soaps and towels separate. That should not be shared. So basically, the first point is avoid sharing of your clothes, shoes, and any such articles, including the soap. The soap bar has to be separate from one person to another person, so that the spreading will be stopped at that stage. Secondly, as we discussed in the beginning of this session, the moisture content on the skin is a primary factor that is going to trigger the multiplication of the fungus. So we have to avoid sweat retention. So if the person is having the tendency to sweat a lot, or if their labor or the work which they do is making them sweat a lot, they have to take bath twice a day, once in the morning, once in the evening, preferably using lukewarm water or cold water. Hot water is not recommended when the person is suffering from a fungal infection.
And the clothes which they are wearing has to be washed in hot water, and it has to be dried up in the sun. The sun is the one thing that is going to kill the fungus. Even normal detergents like Dettol, Savlon is not going to kill the fungus. They're all antibacterial in nature. They are going to kill the bacteria which is present in the clothes, but not the fungus. So I have patients who tell that we wash the clothes in Dettol. That is not going to help you. You have to use hot water, and it has to be dried up in the sun. It's the heat and the sunlight that is going to destroy the fungus. But if you are living in certain weather conditions where there is no sunlight at all, the weather is always cloudy, always foggy, then you have to iron your clothes, especially the inner ones. Innerwears has to be ironed. The bunions and panties and underwears have to be ironed using an iron if you stay in a place where the sun is not at all there. So these are the two most important things, along with taking bath and usage of dusting powders. When dusting powders are applied in between the skin folds, like for example in the underarms, in the groin region, it is going to absorb the sweat. Even normal talcum powders also will work that way. When it absorbs the sweat is absorbed, and that will not promote the multiplication of the fungus. So these are the steps to avoid fungal infection.
Right. These are really very small steps, but that can make a big difference in our routine and can prevent fungal. We have questions from many of our viewers. Mr. Deepak Saxena is asking, which topical antifungal can cause irritation?
Most of it actually, whenever there is a fungal infection, any kind of topical application will cause irritation. We cannot tell that only particular.
Am I audible?
Yes, you are audible now.
And we have one more question. How do antifungal shampoo help with dandruff?
Yeah, and the fungus which is causing dandruff is a completely different organism than what we are discussing from the ringworm infection. So the dandruff is actually caused by a fungus. I wouldn't say it is definitely an infection. Dandruff is not an infection per se. It is nothing but the reaction of the body to the fungus which is normally present in the body. That fungus is a normal commensal. Commensal meaning the fungus is normally present on the skin, and it usually doesn't cause any problem at all. But in certain people, the body itself will start reacting to that normally present fungus. And that is when dandruff occurs. The most important trigger of factor is oil. If you keep on applying oil for a longer period of time, that is going to trigger dandruff. So oil is not at all indicated whenever you're having dandruff. And if at all you feel that oil application is necessary because of frizzy hair, it has to be applied and washed off within half an hour. So that is how the antifungal medications will work for dandruff, because that kills the normal fungus which is present on the skin, thereby eliminating dandruff.
Right. We have one more question. Yash wants to ask, how do antifungal drug work?
Just like I said, it is not so easy to explain it to a non-medico, the different parts of the fungus and how each of the drugs work. The simple category is, like I told you, fungicidal, where the antifungal drug is going to destroy the covering of the fungus. Thereby, whatever contents are present in the cell of the fungus is going to leak out and the fungus is going to die. The second mechanism is the antifungal medication will act on the DNA and the nucleus, or it is called the DNA is present inside the nucleus. So it acts on the DNA of the fungus, thereby preventing the multiplication of the fungus. Once the multiplication is stopped, the immunity of the body will kill the fungus. Those are the two varieties of antifungal medication.
Many times we see fungal infection in our nail bed. Is it different than skin fungal infection?
It is usually the same organism which causes the infection. When we say superficial fungal infection, it is that infection which affects the skin, the hair, as well as the nail. So whatever we see in the nail is also the same fungus, but a different category. There are 3 different categories in superficial fungal infection. I wouldn't go into the detail. So this is the same type of fungus which actually affects the nail also.
What are other kind of conditions or these fungal infections, like you mentioned ringworm infection, this nail bed infection? What are other fungal infections that we see in day-to-day life or that we see very frequently?
Very frequently, the other kind of fungal infection is called candidiasis. The candidiasis can affect the skin, but most commonly it affects the mucosa. We see that infection usually in the oral cavity as well as in the vaginal region, and in men we see in the penis region. So candidal infection can occur in these three portions more in these three sites more commonly, like the oral cavity, the vagina, and in the penis.
Right. Okay. We have one more question. How long will I have to take antifungal medications?
Like I said, I treat my patients to minimum of 2 months to a maximum of 4 months. That is, we require 2 months of treatment at the present scenario.
So depending on the severity and I guess the region of infection that may affect.
Yes, it depends on severity, the region of infection, and also whether the patient has already taken antifungals. If the patient has already taken antifungals for say 1 or 2 months, but the infection is not subsiding, then we add 2 or 3 extra antifungals, and the treatment will continue for 3 months, 4 months to 6 months based on the response of the patient. So based on all these conditions, we decide which type and what dosage to give and how long to continue the infection. But the minimum as of now, we have to give it for 2 months. That is the minimum.
Right. So I guess the best thing is to immediately consult a skin expert whenever
Yes.
we see a little redness or itchiness that
Exactly. The first most important thing is diagnosis. What happens is many of the conditions are diagnosed as fungal infections, but they are not fungal infection at all. They're being treated wrongly. So wrong diagnosis will result in wrong treatment. And when the patient continues taking antifungal medication for such longer period of time, and the fungus has developed resistance to it, and in the future, even if they develop an actual fungal infection, those drugs will not work at all. It is going to stop working in that particular patient, and that patient is going to transmit that fungus to his wife, to the neighbors, and to the kids also. And again, that patient also will not have any response to the antifungus. So self-medication is not at all advised in any kind of skin condition or skin infection for that matter, because wrong diagnosis has resulted in a lot of problems and a lot of misuse of drugs, abuse of drugs, as well as in resistance development. And again, that is creating a problem for us. We are trying to find new antifungal medications every day, but as soon as it comes to the market, they start abusing it, using it day and night, and it develops resistance within 6 months or 1 year, that we have to find another antifungal medication within 1 year. So self-medication is not advised in a fungal infection.
One of our viewers, Meenal, is asking, can over-the-counter antifungal treatment be effective?
That's the thing I was speaking as of now. The problem with over-the-counter treatment is that the dosage is not correct. First of all, the diagnosis. How are you sure that you're having fungal infection? You might think that it is a fungal infection. It might be something else. Okay, first thing. The second thing, even if you're sure that it is a fungal infection, when you buy an over-the-counter drug, you're not sure about the dosage. You don't know how much to take, how much to apply, and how long to apply. Since the dosage is not appropriate and the dosage is not good, it is not going to be effective. You are actually promoting the fungal resistance by taking over-the-counter drugs. And when you actually visit a dermatologist in future, even our drugs will not work on you.
Right. One more question is there. Are there any home remedies or diet to cure fungal infection?
Diet will not cure fungal infection. To some extent, coconut oil actually has an anti-fungicidal property, but that is only to some extent. You can actually reduce the itching and the burning sensation to some extent by applying coconut oil on the regions where you have fungal infection. But it is not possible to treat it completely only with coconut oil. Diet has no role in fungal infection.
Or any home remedies to cure fungal infection or initial stage of fungal infection?
No. They can apply coconut oil just to soothe their skin and until they meet a dermatologist, but no such home remedies.
We have one more question from Monica Sharma. Can antifungal medications be used for pets?
Yes, but not those which are marketed for humans. The dose will actually be designed based on the body weight and the condition of the person as such. So don't use antifungal medications which are available for humans on the pets. You have to visit a veterinarian doctor and to take that appropriate dosage for your pet. Don't use your drugs on the pet.
True. One more question is from Mr. Rohit John. What are Pauline antifungals?
Just like I said, Pauline antifungals are a category of antifungals. We have some 10 categories of antifungals actually. Pauline antifungals actually act on the DNA of the fungus, thereby preventing the multiplication. So they're fungistatic.
Right. I remember one incident. It happened with one of my friends. She had a urinary tract infection initially, and then suddenly she developed very severe stomach ache and she wasn't able to get up from the bed. And then she was diagnosed with some bacterial infection inside over her kidneys with fungal infection. So can bacterial infection prepare a bed for fungal infection to increase or fungal infection to set on?
Yes, that can happen. If the bacterial infection is staying for a longer period of time, that is, it is a chronic infection and the treatment is not given at the appropriate time, then bacterial infection can actually damage the structure and the environment in the kidney, and that might provide an environment for the fungus to invade. Normally, fungus cannot invade if the immunity of the body is normal. But if the bacterial infection is there for such a longer period of time that it has actually reduced the immunity and it has damaged the structure of the kidney, it can prepare a bed for development of fungal infection.
Right. So in that case, both antibiotic treatment and antifungal treatment should be prescribed.
Yes, definitely. Again, it means the patient has to be admitted in such cases. They cannot be treated from home. They have to be admitted, and both the medications, especially the kidneys are involved, the tablets will not work. The injections, the antifungus as well as the antibiotics has to be given through injections only.
Are there any laboratory tests to detect fungal infection or the types of fungus that infected our organs or skin?
Yeah, what we do in a ringworm infection is we scrape out the lesion and we take the scales. Usually we have scaling, that is, there is peeling of skin in the fungal infection. So we take out those scales and we send it to the laboratory for what is known as potassium hydroxide mount. So the potassium hydroxide is applied on those scales and it is observed under the microscope. After putting the appropriate dye for the fungus, we basically color the fungus to look at the structure. So once we do that, based on the structure, or how long it is and what are the number of spores and how it is dividing, based on that, we can identify the type of the fungus which is there. We also do something called as fungal culture, wherein these scales are embedded in an appropriate growth culture media, and we wait for usually like 72 hours to 1 week because fungus is a slow growing organism. So after 1 week or so, we observe the colonies and again microscopic examination is done to find out the type of the culture. But whatever said and done, our treatment will almost remain the same. So we don't routinely do a fungal culture or a potassium hydroxide examination in a routine thing. We usually do it whenever we are doing it for research purposes only.
Right. So research purposes, you just said, what are new advancements are made in treating fungal infection or any technological advancements in making new drugs or treating?
Nothing as such. We are not having any like super drugs or something that is actually going to target the drugs. What we have come up with is that we are bringing up more drugs which are having more of bioavailability. Like recently from the last 1 or 2 years, we have drugs which are called super bioavailable azole group of drugs. Before we had a problem that even though we are giving high doses of drugs to the patient, the drug is not entering into the blood and thereby it is not reaching the target tissue. If the quantity of drug which is reaching the target tissue is less, then the fungus will not be killed at all. So now they have come up with super bioavailable drugs where the molecular size is reduced so that the absorption is better and the quantity that reaches the target tissue is in the higher stuff. Apart from that, they are coming up with newer drugs and trying out newer ways of killing the fungus. But again, they're still in the trial mode and none of them have actually come into the market. And even few of them which are coming to the market are not available in India. They're still under trial phase outside India.
we have many bacteria which resides in our body, but which are useful for us, like bacteria in intestine or in mouth or oral cavity. You said that fungus, when we were talking about dandruff, so you said that fungus is normally present on our skin. Is that true? I mean, are there fungus which are normally residing in our body?
Yes, yes, yes. Just like we have normal bacteria residing on the body, we also have normal fungus residing in the body. The one which I told you is the one that causes dandruff. The other one is candida, the yeast infection. Even the yeast is also normally present in our oral cavity as well as in the vaginal region. And we have the fungus which causes the bacteria, which causes dandruff. We call it malassezia. So malassezia and candida are normally present on the skin, and there are other type of fungus also which are normally present on the skin, and they're actually helpful to us until the immunity breaks down.
Right. So, fungal infections which appear on skin, they may start to appear like a small papule or rash.
Yes.
And what about oral cavity? I mean, oral fungal infections, do they look similar to skin infections or different?
No, it's different because the fungus which causes skin infection will not cause infection in the mouth. It only stays in the skin. So what fungus causes an oral cavity infection is called yeast infection, or in medical terms we call it candidiasis. So candidiasis usually in the initial stages will cause redness of the mouth, and there is burning and soreness, and slowly there will be a whitish patchy or membrane like structure which forms in the buccal mucosa as well as over the tongue. So that is the feature. There will be whitish membrane-like structure which is formed on the tongue and in the buccal mucosa. And the symptoms will be, there will be burning sensation, difficulty in swallowing, and soreness of mouth and loss of taste.
Right. So, treating oral fungal infections, how are they different from skin infections in terms of treatment?
The advantage of candidiasis is that it has not developed resistance to our antifungal drugs till now. So it is still susceptible to the most common antifungal drug. And just by maintaining hygiene of the oral cavity, candidiasis can be treated. Like repeated swishing of mouth and brushing twice a day, avoiding chewing of pan, betel nut, these gutkhas, whatever is available in the market, avoiding smoking. All those is enough to actually control the fungal infection which can occur in the mouth, that is the yeast infection. The same thing applies to the vaginal as well as the penile infection of the yeast. Just by maintaining a normal hygiene is more than enough to control such kind of infection. But if the patient is immunodeficient, that is they're having immune deficiency like uncontrolled diabetes, HIV/AIDS positive patient, or they're on any drugs which has reduced their, suppressed their immunity, then treatment has to be aggressive for such kind of infection. Otherwise, just hygiene maintenance is more than enough.
Right. Patients who have undergone some surgeries or intensive medical treatment where multiple cuts and sutures are made, are they susceptible to fungal infection more? Like they are susceptible for some sepsis, or during suture procedure, they may develop some kind of infection. So can fungal infection grow in such cases?
No, usually fungal infections do not affect the suture sites and stuff. It is mostly the bacteria which causes the infection in there. But fungal infection will not affect such patient until and unless their immunity has to be suppressed. Either because of the extensive surgeries, or they're having problem with their immunity, their hemoglobin has come down, and the drugs which were given during the surgeries has actually reduced their immunity. Until then, the fungus will not invade into the deeper portion or does not infect the suture site.
You have vast experience in your field, and you have treated many patients, you have come across many cases. What common myths have you seen in patients about skin treatments or fungal infection or any kind of skin problems?
The most common is that diet is directly related to that. They stopped eating non-vegetarian food. They say that brinjal actually increases their itching. They have their own myths, like they link the itching and the infection to one particular food or something. So that is the first thing. So I want to clear that myth. Diet has no role in fungal infections. So stopping of non-vegetarian food or any certain vegetables will not affect your fungal infection in any way. That is the first thing. Second thing, most people don't know that it actually spreads from one person to another person. So they continue using the same soaps and towels and stuff, thereby spreading the infection to an entire family. So that is the second thing. It is contagious. It spreads from person to person. So keep all your articles of soap, towels, innerwears, everything separate. It should not be shared between the family members. The third thing is they try different kind of remedies that I applied turmeric, I applied coconut oil, I applied that, they apply all kind of medications and they expect it to come down. That is not going to happen. Again, that is going to cause a lot of problems. These are the three most important myths which I come across.
Fungal infections, after they get treated, do they leave any scar or marks on skin?
No. In the initial stages, say I completed the treatment for 2 months, and for the next 1 month, there might be a little pigmentation present. But over a period of time, even that pigmentation also will disappear without any trace. So scarring is not seen in a fungal infection until and unless the patient, just scratches it so vigorously that the skin itself is damaged beyond repair. Or the second most what we experience nowadays is steroid abuse. Patient go to a pharmacy and tell them that I have a fungal infection or I have some rash on the groin region. The first most common thing they give to the patient is a steroid cream, Pandem Plus, Tenovate, Betnovate, Dermi5, KT5. There are so many drugs. The thing is, they are very cheaper available. Patient also is happy. I got the drug for 70 rupees or 100 rupees. If I go to a doctor, I have to pay a consultation. Then I have to buy expensive drugs. So they're very happy with the drug. But the problem with those drugs are they're not supposed to be applied for any kind of fungal infection, first of all. Those drugs are the one which is going to cause problems in future. One thing is they, over a period of time, reduce the immunity of the skin, thereby impairing the body's immunity to fight against the fungus. So that is going to cause the spreading of fungus will be so extensive once the cream is stopped. Second, again, it is going to promote fungal resistance. So when the patient has used steroid creams for such long period of time, our antifungal drugs will take again much more time to start working and kill the fungus. And the scarring will occur because of the use of these steroid drugs. The patient will develop stretch marks, kind of striae, redness, and there will be peeling of the skin. All those scarring, there will be thinning of the skin, atrophy. That is going to be present because of the steroid application on the fungus and not by the fungus per se. The fungus is not going to destroy the skin to such an extent when compared to a steroid cream. The steroid cream, which is applied, without consulting a dermatologist for a longer period of time in a wrong body area with a wrong dosage, is going to destroy your skin beyond repair. It is so difficult to repair. We cannot get back to the normal condition. That is the thing that is going to cause scarring. Fungal infection will not cause scarring.
Right. Before ending our session, any tips for our viewers to keep their skin in good condition and to make them understand more about skin problems and fungal infections?
So again, the take-home message is, or whatever I told right now, I'm going to summarize for that. The first thing is maintenance of hygiene. When we come to hygiene, please take bath daily, once a day at least. And if you're having too much of sweating and you're staying in a humid environment, you have to take bath twice a day. Secondly, keep your soaps and towels and all the clothes separate. Do not share your innerwears, shoes, socks, clothes or soap baths with any of the people. You have to keep it separate for yourself. Whatever clothes you're wearing has to be completely dried up in the sun. Do not dry your innerwears inside your houses. That is not going to kill the fungus. It has to be dried open air in the sun. So that is going to kill the fungus. So use dry clothes. Do not wear any of the clothes which contains even a little bit of moisture. Fourth thing is avoid tight-fitting clothes, especially when you're having a fungal infection. Like for my patients, I tell them avoid jeans and leggings when you're having a fungal infection. Those clothes actually are so tight, they stick to the skin and they promote sweat retention. That is again going to promote multiplication of the fungus, and it is very difficult to treat fungal infection when sweat retention is continuously going on. So avoid tight-fitting clothes like jeans and leggings, especially if you are prone to hyper sweating and if you are having a fungal infection. Then whenever you develop any kind of skin problem, I suggest please visit a dermatologist. I have never seen a patient going and buying over-the-counter drug if they have a heart problem. They go to a heart specialist, right? If you're having a heart problem, you visit a heart specialist. If you're having a problem in your kidney, you go to a kidney specialist. You don't go and buy drugs for heart from the over-the-counter pharmacist, right? Or you don't present to your neighbor or your, samne wali, pados wali auntie and buy a drug for your heart condition. You definitely visit a heart specialist to treat your condition of the heart. The same thing holds good for your skin also. Skin itself is an organ, and we need an expert who can diagnose correctly, who can dose the drug appropriately at the appropriate time to treat your skin condition so that your skin health is also maintained. So please visit a dermatologist for any kind of skin infection or skin condition to get an appropriate diagnosis as well as correct treatment and for the correct period of time. Please avoid self-medication and please avoid buying drugs over the counter.
Thank you so much, Dr. Reshma, for a valuable time. And it has been quite an informative session for our viewers and for me too. We look forward for many more such sessions in coming time. Thank you so much for joining.
Thank you. Thank you so much. Have a good day.
And thank you, viewers, for an excellent participation. For more such information and updates on skin health and care, stay connected on our Facebook page, all about skin well-being. We are also available on YouTube, Twitter, and Instagram, so do get connected with us. Thank you and have a good day to all. We'll see you soon. Thank you.
Yes, good day. Bye-bye.